Good evening, everyone. My name is Kavisha from Team M3 India and would like to welcome you all to today's webinar on the topic of managing mosquito-borne diseases. To enlighten on this topic, we have a very special guest speaker today, Dr. Mohmed Soeb A. Jankhwala. Dr. Jankhwala is a highly qualified individual with an MD in microbiology and a fellowship in medical education. He currently works as an associate professor in the Department of Microbiology at Nutan Medical College, Gujarat. He has also worked as a consultant microbiologist at Sterling Hospital, Vadodara, and served as an associate professor in the Department of Microbiology at Parur Institute of Medical Science and Research. Dr. Jankhwala has published numerous journals, case studies, and articles, including the recent publications in 2023 titled as Quality Control in Processing of Respiratory Specimens in Microbiology Laboratory, a Systemic Review, in the International Journal of Pharmaceutical and Clinical Research. On behalf of Team M3 India, I would like to welcome Dr. Jankhwala to today's live webinar. So viewers, if you have any questions regarding the topic, feel free to type it in the question boxes available on your screen. Doctor will try to answer as many questions as possible towards the end of the presentation. With that, I would like to hand over the session to the doctor. Thank you so much.
Very good evening. Thank you so much, Kavisha, for the warm introduction. I would like to thank Team M3 India for giving me this opportunity and providing me this platform through which I'm sharing my presentation. So today's session is all about managing mosquito-borne diseases. Within a span of 40 minutes, I will try to cover these many points. So at the end of this presentation, participants will be able to identify common types of mosquito-borne disease and their causes and symptoms. Participants should be able to explain pathogenesis of various mosquito-borne diseases. They should be able to learn about the latest diagnostic techniques which is used to diagnose mosquito-borne disease. And they should be able to explore various prevention strategies that can help reduce the risk of mosquito-borne disease. So in rainy season, there are the various mosquito-borne diseases like malaria, dengue, chikungunya, Zika virus, and yellow fever. So malaria, basically, it is transmitted by female mosquito. This is the Anopheles mosquito, which can cause fever, chills, and flu-like symptoms. Dengue and chikungunya is caused by Aedes mosquito. So they mainly causes high-grade fever, joint and muscle pain, and rashes. Now regarding the dengue virus, so dengue virus, which belongs to Flaviviridae family. So basically it's a flavivirus, and they have 4 serotypes, dengue 1, 2, 3, and 4. Fifth serotype is isolated from the Thailand, but it is not still detected in India. Human infections arises from the human mosquito-human cycle. So, dengue virus, so it is caused by Aedes aegypti. It is called as a tiger mosquito. You can see there are the white and black stripes over the legs, over the trunk. So they are female Aedes aegypti. They are the daytime feeder. So they bite during the daytime. They live in and around human habitations. They lay eggs and produce larvae preferentially in artificial container. So these are the breeding sites of the mosquito. So they found in the nearby the human habitations, and they lay eggs in fresh water. Talking to pathogenesis. So when any person is first time infected with any serotype, so there are the 4 main serotypes. So if any person during his or her lifetime is infected with any serotype, it is called a primary dengue infection. Months or years later, so when a person is infected with another serotype, it is the second serotype, which is different from the first serotypes causing the primary infection. So there are more chance to develop dengue hemorrhagic fever and dengue shock syndrome. So to justify this, if a person is infected with serotype 1 during the primary infection, and after the months and years, if the person is infected with dengue serotype 2. So they are more likely to develop dengue hemorrhagic fever and dengue shock syndrome. So after the dengue infection, antibodies are produced. There's a natural response. We have innate immunity and acquired immunity, right? So as a part of the acquired immunity, antibodies are produced against the dengue virus. So it's our immune response. So there are the two types of antibodies which is produced, neutralizing antibodies and non-neutralizing antibodies. The name itself suggests neutralizing antibodies neutralize the virus. They are protective in nature. Such antibodies are produced against the infective serotype, which last lifelong, as well as against the other serotypes, but which last for some time. So this neutralizing antibody protects human from viruses in three ways, basically. So first, it will cause neutralization. Antibody blocks virus interaction with the host cells. Opsonization means antibody coats the virus and typically targets its uptake by the macrophage and neutrophils by the means of the opsonization, and it is phagocytosis. Third mechanism is ADCC. What is ADCC? It's antibody-dependent cellular cytotoxicity. The name itself suggests killing is done by the cells, that is the CD8 cells and NK cells. But antibody will coat only those cells which is infected with dengue virus. So antibody won't coat other cells, they are not infected with dengue virus. So antibody will coat only those cells which is infected with dengue virus. Now after coating of this antibody, cells will come, that is the CD8 and NK cells, and they will destroy the infected cells. So this mechanism is called as a antibody dependent cellular cytotoxicity. So basically, so these are the three ways by which antibody destroys any viruses. Okay, so these are the role of the neutralizing antibody. In dengue, non-neutralizing antibodies are also produced, but typical feature of this non-neutralizing antibody is that they are heterotypic in nature and they are IgG. So what do you mean by this? So this antibody will bind with another serotype. So for example, if person is infected with dengue 1 serotype, so this heterotypic antibody will produce against any other serotypes other than serotype 1. So during the secondary infection, this antibody, which is non-neutralizing, so it won't neutralize the virus, but it will bind with the virus. And this entire complex is taken up by the macrophage. So this fundamental is called as an antibody-dependent enhancement. So dengue virus then replicates in this macrophage, thereby increasing viral production.